And Mr. Alipate has also revealed that the federal government is committed to working with state governments and community leaders to ensure that every Nigerian child gets the life-saving tool of vaccines as well as treatment for other diseases. The health minister disclosed this during a visit to primary healthcare centers in Nasarawa State. And health correspondent Kemi Balogun has details.
This tour of some primary healthcare centers in Nasarawa State by the federal government and a team from the Global Alliance for Vaccines and Immunization is part of efforts to put mechanisms in place and strengthen the system ahead of the phase-by-phase rollout campaign to reach zero-dose children. At the Etsukaru Palace in Nasarawa State, this gathering of government, global partners and traditional rulers are all in agreement that more needs to be done to ensure that there is a reduction in the number of zero-dose children across the country.
Vaccines work, and they're the most cost-effective tools. Among the most cost-effective tools, they're safe and they work, and they've protected many children from diseases like measles, like polio, diarrheal diseases, pneumonia. But there are still many children that we miss, and that we need to do more to ensure that we reduce those who are completely missed, the zero-dose children.
In order to demonstrate how his leadership has helped Nasarawa State came first when it comes to COVID-19 vaccination.
The potential is by 2030 to save 5.6 million people's lives. And that does not even exclude many other potential vaccines such as malaria that we can bring to this country.
Nigeria accounts for the largest number of zero-dose children in the world, with more than 2 million children still missing. Traditional leaders have continued to play a vital role in getting communities to key into health interventions through synergy with government and their communities, using advocacy, mobilization, and trust building.
We plan to further intensify the engagement of our religious leaders to facilitate access to eligible children for immunization and other primary healthcare services in security compromised areas. We in Nasarawa State are a bit lucky. We have very minimal of such places.
This kind of partnerships has helped to achieve success in tackling polio, and this campaign is expected to be no different. Kemi Balogun, TVC News, Abuja.
The World Food Programme has pledged to support the Tinubu administration in implementing its food security and zero hunger program under the Ministry of Humanitarian Affairs and Poverty Alleviation. World Food Programme country representative David Stevenson disclosed this when he paid a courtesy visit to the Minister of Humanitarian Affairs and Poverty Alleviation, Betaredu. He applauded the plans of the minister in setting up humanitarian hubs in all the local governments across the country, adding that about $2.5 billion will be spent on the 2.1 million people already captured in a register to fight hunger and food insecurity.
You have been able to reach out to 2.1 million Nigerians. That's a whole lot, and we appreciate the hard work and efforts that must have gone into this because we have the challenges facing us, staring at us in the face, and we must provide solutions to them. That's what we're here for. Targeting both pregnant women, children under 5, school feeding of persons who are affected by humanitarian crisis, other persons of concern, including refugees that have found themselves within our space. We have over 80,000 persons as refugees presently.
We talked about zero hunger. We talked about the humanitarian hubs in every local government area in the country. We talked about the World Food Programme's potential to support those hubs through buying food locally and also providing assistance in the cash transfer in the food voucher network that we have primarily been focusing on in the Northeast.